Welcome to Destigmatizing Justice, the podcast where we tackle the tough conversations about conflict-related sexual violence against men. Brought to you by the Center for African Justice, Peace and Human Rights, we're here to break the silence, challenge the stigma, and champion the rights of all survivors. Join us as we explore expert insights and actionable steps towards justice and healing. Together, we can redefine justice because every voice matters. Welcome back to Destigmatizing Justice. My name is Saniamu and I'm here with my colleague Sally. On today's episode, we're focusing on the broader implications of conflict-related sexual violence against men and boys and how it's addressed.
On that note, we're honored to have Nelly Staderini here with us from MSF Geneva. MSF, more commonly known as Doctors Without Borders, is an international independent medical humanitarian organization that provides medical assistance to people affected by conflict, epidemics, disasters, or exclusion from healthcare. Thank you, Nelly, for joining us.
Hello, everybody. So my background is the fact that I'm a French midwife, and I had 10 years of field experience. And I'm in the HQ of MSF in Geneva, leading the woman and child healthcare portfolio for the medical department. So the sexual violence is part of the sexual and reproductive health portfolio since years. And I think this is how I get into this deep understanding about the male victim. So 10 years ago, we started a collaboration with the Center of Humanitarian Studies in Geneva, and we developed a short course related to the sexual violence in humanitarian settings. And we put the focus on the male victim from day one. And in addition to that, there were requests from the Swiss cooperation to have MSF as part of the advisory board of an initiative that started 8 years ago on the research on male victim of sexual violence in conflict-related setting. And this is what we call the All Survivor Project. So in addition to those two things, I did 2 years ago a master on advocacy and policy making in the Graduate Institute in Geneva. And I took also this topic to study. And late new that I attended to a UN meeting at the end of 2024 that was celebrating the 15 years of the work done by the team of the special representative of the Secretary General on sexual violence in conflict, and the testimonies on the male victims were included into different speeches. So just to highlight that there is an increase knowledge and willingness to work on this topic.
Thank you. It's good to know that it's actually being addressed because we have that whole issue of thinking that it doesn't get the recognition that it deserves, but it's good to know that it has a basis. All right, so moving on to our second question. Based on your understanding of the crime, why is sexual violence so often deployed as a weapon of war, specifically against men and boys?
I'm taking that from an article that was published by All Survivor Project because I think it's quite illustrative. So sexual violence in conflict can be used as a form of torture that is aiming to inflict psychological suffering, terrorize, humiliate, disempower and break down the identity of what they perceive enemies or political prisoners. So the perpetrators of the sexual violence against men often seek to impose domination, power, and control through their acts. The sexual violence had been used for torture, also interrogation, and as well initiation into military or even paramilitary forces to destabilize the families, but also to terrorize the communities, to dismantle the social cohesion, and sometimes with ethnical consequences. So sexual violence often occurs jointly with other kinds of crimes, including the forced displacement or even arbitrary detention. The challenge that we see today, the research in documenting the prevalence on this crime, and the data are still extremely limited. but studies indicate that the phenomenon is widespread. There is also something interesting to highlight is related to the culture norms about the masculinity and the sexuality. And when men and boys are raped or subjected to other forms of sexual violence, it's not only related to their identity, but also to undermine their role as protectors or leaders or providers within their own communities.
That's very interesting, yeah. So especially to do with their masculinity and that the very foundation of who they are and how that then plays into society.
Yeah.
So thank you. I'll move on to the third question. That is, over the last 10 years or so, you've been a member of the steering committee for the course addressing sexual violence in conflict and emergency settings, which specifically acknowledges men and boys as victims of conflict-related sexual violence. Could you please explain the key challenges of addressing conflict-related sexual violence against the male gender, and what suggested interventions are unique to male survivors, if there are any?
Yeah, they are. So just a few things related to the course as such. Addressing sexual violence against men and boys has emerged as a transformative element into this course evolution in the past 10 years. And the course deliberately positioned this topic early in the curriculum to ensure that participants can develop a gender inclusive perspective during the course. And it's addressed all aspects of the training, starting from the concept of the survivor-centered approach, and also all the different specific components like the medical response protocol and also the access to justice. Central to this transformation has been the authentic integration of the male survivor's voice and also expertise, and through the contribution and participation from some men from the Men of Hope, that is a survivor network in Uganda, and also we did also include other survivor groups. So about the key challenges that you were referring to, they are mainly the structural barriers, the institutional challenges, and the social factors. So if I go back to the structural barriers, today there is a limited legal protection and difficulty to access that. In addition to some discriminatory legislation, particularly laws that are criminalizing the same-sex relationship. There is insufficient access point for services and sometimes fragmented or even absent of referral network between those different support systems. For the institutional challenges, there is an inadequate community outreach or even education on that. The workforce have limitation in terms of training opportunities, and we see problematic attitudes and practices among service providers sometimes. So for the social and personal factor, there is some social stigma, limited awareness, limitation in availability of resources, and stigma, shame, and reluctance to seek formal assistance sometimes from the victims. There were a nice article published by All Survivor Project related to the research work that they did in Afghanistan, highlighting the multiple barriers that survivors can face. So in addition to the stigma and fears from the family, fears from the judgment of the healthcare provider, there is also something related to their diverse sexual and gender identity, where they are facing higher risk. There is something that is not so well understood in terms of the desire related to the sex relation and the cultural practices that is demonstrate a weak understanding about what is happening. So I think it's interesting to highlight that because the consequences is a potentially misidentification of the survivors, especially when there is a diverse identity. And The stigma around that make the men afraid to be signaled, and sometimes they feel challenged in their masculinity. So there is a lot that can be done on this awareness. We also see in terms of challenges, the inadequate services, because when they are there, it's mainly open for female survivors, and this might not be really adapted to what the male wants. So what could be the suggested intervention? And the key principle, they have to be appropriate, inclusive, and competent in terms of response. In terms of the design of the intervention, but also the capacity building for the staff that will be in charge of the care. And this can go up to the advocacy level that is needed. There were other studies by All Survivor Project in Colombia, highlighting that the survivors' desire are around the free to be judged, and the blame and the stigmatization. They really want the healthcare provider to acknowledge the unique circumstances, and they want confidentiality, they want privacy, and they don't want to be assimilated as women or girls, and they want alternative service provision. Something interested in the study as well was the fact that they expressed that they want a peer group support, and they just not to feel alone, which was what was happening to them. There is some therapeutic value within this group support, and this can also help them to go to leadership position and help them also to do some advocacy from what did happen to them. The male specific support services should provide trauma-informed mental health services, as well as counseling, in addition to medical care that have to be tailored to the experience. They also want to raise awareness and advocacy to be able to give visibility around the specific issue around that, and they need to work on the legal framework to ensure that the male victims are properly recognized. Another interesting point is the fact that we need to engage the male survivor at the program implementation, include them in the decision-making process around the programming and the intervention to ensure that their unique needs are met.
Thank you. It's very interesting to see that it also requires such a multifaceted approach. There's so many layers to it. Yes, my fourth question for you then is, in your opinion, is there a correlation between the lack of support for male victims of conflict-related sexual violence and the susceptibility of women and girls to sexual violence potentially in the future?
Yeah, I think it's more than susceptibility. The fact that the woman and girl have a higher risk of exposure in all settings, or at least this is what we see to now. And even the evidence are showing that women and girls are still disproportionately affected by sexual violence. However, it's true that male and boys can also be victim and targeted as sexual violence. And the fact that they are seen today as only in addition to is something of concern. So it deserves a deeper understanding and to propose something different and not only in addition to women. But let's remember that the power and the control that are driving force for the conflict-related sexual violence are something that is important to keep in mind. Also, the acts of violence during the conflicts are linked to the society's norm that are preceding, but also aftermath of the conflict. And the men, the women, the girls, boys, non-binary individuals are positioned by and through the violence differently. So ignoring this specific group of survivors results in limited understanding on who and also why the sexual violence is used during armed conflict and in effective policy and intervention. But yes, there is a correlation.
I'd like to move on to asking, as a member of various advisory boards, as you'd mentioned earlier, and these boards being concerned with sexual violence in humanitarian settings, have you identified any trends or consistencies in national laws and policies among countries that have reported a high number of conflict-related sexual violence cases against men and boys?
I think it's a complex question, so I will try my best to answer, knowing that I'm not a lawyer. Even today, where a lot of work is done, I'm thinking specifically about the recent conflict in Ukraine. So when there is a focus, it's still very difficult to have numbers. So there is some reports, there is some documentation, but they are still highlighting a limited number of cases. The fact that what is interesting is the fact that even if there is a limited number, it was enough to start to raise awareness, to share the report, to share the content, and to share the concern at high-level meetings. And from that, there were development of new guidelines to address the needs. I think this is part of there is also an additional work that is done on the national laws and the policy. But I would say that this is only emerging and in very few contexts. And let's see what will be the impact and the influence on other contexts. My feeling is that it's a little bit too early to say today. But at least what we can say, this is taken quite seriously by some UN agencies, by some military institutions as well. And there were a recent article on the 3rd of March that was published in The Economist. That is very interesting because the title is "It's Time to Treat Sexual Violence in War as Torture." And it was written by a UN rapporteur. So what we can see in this very recent article is the fact that there is an acknowledgement on the fact that such crimes are increasingly part of the military strategy. And this needs a fundamental rethinking on how do we want to address the sexual violence in wartime. And this is a urgent need to address. So one thing that was explained and proposed is to reclassify such violence as torture. And by charging sexual offenses under the existing torture laws, in both domestic or international court, this could allow to have a better prosecution. So there is a growing number of states that have explicitly included the sexual violence form as torture within the crime of torture. And in a way, the fact that it's a global prohibition on torture is binding on all states, and the fact that it's a fundamental principle of international law that must be applied everywhere is an advantage, because then we could act immediately. This change of approach could also lift the intense burden of the shame that often accompanies the victim of rape. And by considering victims of sexual violence as a survivor of torture, the shame will or should shift to those who should carry it, that is the perpetrators. Because there is no shame to be a survivor of torture. And what is interesting is the fact that torture survivors have historically been viewed as heroes who have overcome adversity, and communities tend to rally around their recovery and rehabilitation. So it might be the time for the same recognition to offer for the victim of sexual violence in conflict, who are still very much stigmatized.
Thank you so much, Sally, and thank you so much, Ms. Staderini. And just to go back on what you said, I definitely think that considering the victims as survivors instead of victims definitely shifts the blame to those who should feel it, that being the perpetrators instead. So in your article that you co-wrote on sexual violence in the DRC, you note that a veil of silence covers cases of sexual violence against men and boys. What are the primary concerns and consequences of the lack of reporting?
I think the main issue is the silence surrounding the male victim of sexual violence, and this has severe consequences. So, firstly, it leads to under-reporting of the sexual violence against men, which in turn means that the scale and the severity of the issue remain hidden. So this lack of reporting exacerbates the trauma, and as survivors may feel isolated and unsupported. And this is what we saw in this article. We were highlighting the first 130 cases that were treated for sexual violence, and we didn't have any male. Because we didn't have any mail, we didn't want it to silence it, but to raise it as an issue.
Thank you so much for your answer. And I'll move on to the next. In 2020, a briefing for the UN Security Council Open Debate on Sexual Violence and Conflict was published, of which you were a member of the advisory board. In the briefing, it was argued that the lack of recognition of male victims of conflict-related sexual violence under the law can negatively influence broader social attitudes and exacerbate the surrounding stigma. Besides amending their laws to recognize male victims of conflict-related sexual violence, what kind of policies would you suggest such nations to implement in order to tackle mostly, let's say, like cultural assumptions about vulnerability?
Yes, so in addition to amending the national laws to recognize the male victim of conflict-related sexual violence, I think it is essential to implement the policies and the measures that are challenge the societal assumption about the masculinity. This includes, for example, the awareness campaign, the sensitization that have to be done for the healthcare professionals and other humanitarian actors. And we need the engagement with the local actors, community leaders, including the religious and the cultural figures, to charge harmful narratives around the male sexual vulnerability and encourage the openness to discuss the male sexual violence.
I think these are very important areas to tackle, and creating awareness is always an important step towards destigmatizing situations such as conflict-related sexual violence against men and boys, especially given the fact that it's underreported and it's often overlooked. And just to figure it out, given your background working on researching and teaching on this issue, are there any success stories that you've come across regarding the regulation of sexual violence against men and boys?
Yeah, I feel more equipped for this answer. So we have few experiences and testimonies. So as part of the training, there is a lot of contribution from the Refugee Law Project that is doing an excellent work in Uganda, and is working in partnership with other male survivors network. So one thing that this Refugee Law Project was highlighting is the fact that when they were screening the different data that they have, it showed that 3 men out of 10 compares to 5 women out of 10 disclose experiences of sexual violence during what they call open dialogue. So it's possible to have people disclose, first thing. Second thing is there is a tend to have a higher rate of disclosure when the screening dialogues are happening in the community rather than in an office. But for this to happen, we need privacy, security, and good translation. They were also a representative of the Men of Hope network that was highlighting the importance of competent, timely, and proactive services to be available and to be accessible for all the male survivors. And there is many other knowledge emerging from the All Survivor project that is working in Colombia, Afghanistan, Central African Republic, and Ukraine. But I wanted to highlight some experience from MSF that came from a staff working with men and boys, Ethiopian migrants, and working in a therapeutic counseling center. So he illustrates the various barriers that initially were for the male victim of sexual violence for accessing MSF facilities, such as the lack of male providers, the lack of specific pathway for the male patient, and at that time exclusive focus on the women and girl survivors, as well as other structural challenges, such as the lack of specialized long-term and comprehensive support for the victim of torture. He also explained that some of the key intentional and specific operational decisions were taken in MSF to allow and to enable some more male victim treatment and support. And this includes the recruitment and the training of an adequate gender-sensitive workforce and the inclusion of the gender-inclusive messaging also for the community awareness session, the creation of a discussion group in the therapeutic counseling center for both women and men to enable this disclosure and to provide some group support, to involve the victim of sexual violence previously treated in the facility as focal point people. And he highlighted the importance of the humanitarian workers in enabling the survivor leaders and network to build an effective response. There was something also interesting highlighted from a human rights professional that is doing investigation. And she explained how crucial is the rapport between the interviewer and the interviewee. And how the human rights professional and the investigators, they must consider the possible physical and psychological consequences of the survivor, and how important it is to refer for an adequate support. So she also flagged the scarcity of this support and the scarcity of the protection response, and how not easy it is to rely on the referral system. She also highlights that despite these challenges, many survivors express a sense of relief at being listened to and empowered as a result of the interview, when they are conducted with empathy and by competent people.
Yeah, it's really interesting to hear that despite everything and the fact that it's a massive atrocity and it has so many negative consequences, there are success stories, especially when it comes to breaking the silence and spreading information on the topic. And to conclude, what are your thoughts on a way forward, such as, steps to be taken by the government, international organizations, and civil society to ensure that male survivors are not just acknowledged, but also meaningfully supported?
Yeah, so to ensure that the male survivors can meaningfully be supported, there is different steps. One thing is about the integration of the male survivor into the international and local policies on sexual violence. Something important as well is to continue to invest into research, and not only highlighting the needs, and but doing research with the survivor and have proposition emerging from them, and to capitalize on success stories. There is also a need to increase the funding and to engage with the male survivor. There is something that was highlighted by Professor Chris Dolan, that is today one of the greatest experts on this topic, that is highlighting the risk of the re-traumatization of the people, and especially when doing the investigation. So this means that we really need to have well-trained people to do this interaction. And he also highlights the difficulties that it is for the international investigators, who generally carry out some very short-term mission in those conflict settings. And it's a challenge to establish the trust with the survivors. And he was highlighting how important it is to build this trust relation if you really want to have the meaningful interaction. He also flagged the need for international justice institution to develop a solid process to adequately check the quality of the service that the survivor can be referred to by the investigator. And those services need to be competent and effective, and with confidentiality and respect for the survivors. Voilà. I wanted to come back on some key messages that is related to the responsibility for the humanitarian responder to create safe space and to really enable the safe discourse for the survivors. Make sure that we can offer timely and competent response for both physical and mental health needs, but also responding to something that is going beyond the needs of the individuals, but really trying to incorporate the family and even some community members. So there is many different concrete steps that we know already that can be done. And one of them is really to work on the variety of the entry doors and the specific pathway to enable the male victim to disclose and to seek care. And for that, we need to work on the recruitment on the staff, and also to give the training on the staff to have this response that can address this, the gender diversity. I already highlighted the empathy and respect. For the justice, I think we need a justice accountable process that can empower also the survivor. And still today, a solid procedure must inform investigators and the overall justicial system to ensure the trust is built between the survivors and the investigator. And to make sure that we are really putting the survivor at the center of the process. So greater efforts have to be put into building this adequate relation and the adequate referral path to have a comprehensive answer. And finally, it is important to engage with the survivors and also the survivor leaders, because there is some leaders, there is some advocates today, there is some networks that are working well, and we need to hear their voice, that are raising their lived experience, but also their knowledge that can be seen as expertise, that can be in the center of the knowledge that we want to share, and that will enable the transformation to an answer with a long-term perspective. And we need all responders to be very active into this new way of addressing the answer.
Thank you so much, Nelly. And I agree, it all goes back to informing the necessary parties and putting the survivor at the center of the problem. And it's so important to engage actively with people who are affected by the crime of sexual violence, and to give it a name rather than hiding behind other terms such as active terrorism. I really, really appreciate your insight, and I'm sure my colleague Sally does as well. And it's been such an insightful discussion.
Thank you very much for the opportunity given to highlight this.
Thank you. I think that brings an end to our interview today. And yeah, as Saniamu has already expressed, we very much appreciate you taking the time out of your schedule to speak with us today.
Thank you very much.
Thank you for tuning into Destigmatizing Justice. We hope today's episode sparked your interest and inspired you to act. Please share it with others and join the conversation on our social media platforms. Let's keep dismantling stigma and building a world where justice is genderless. Until next time, remember that awareness is the first step towards change.